Did you know that ganglion stimulating and blocking drugs have been in the medical world for over a century? Their story began in the early 20th century, when scientists first noticed the intriguing effects these drugs had on nerve ganglions. These nerve clusters play crucial roles in our bodies, and the potential to manipulate them sparked a flurry of research. Scientists were keen to unlock the secrets of these drugs, unraveling their potential to treat a variety of health issues. From high blood pressure to gastrointestinal disorders, the scope of their applications seemed boundless. The curiosity that surrounded these drugs was immense, and their early discovery marked a significant milestone in the field of pharmacology. Fast forward to today, and these drugs are still a hot topic in medical research. They continue to inspire, intrigue, and puzzle scientists around the world. So these drugs have quite a long history, but how do they work exactly? Stay tuned to find out. The discovery of ganglion drugs dates back to the early 20th century. This was a time of significant medical advancements and the birth of modern pharmacology. Scientists were keen to unravel the mysteries of the human nervous system, and in their pursuit, they stumbled upon a class of drugs that had the potential to alter the way we perceive and treat various health conditions. These drugs were the ganglion stimulating and blocking drugs. Initially, ganglion drugs were used as therapeutic agents to treat a variety of conditions. For instance, they were employed to manage hypertension, a condition characterized by persistently high blood pressure. By blocking the signals in the ganglia, these drugs help to relax and widen blood vessels, thereby reducing blood pressure. In addition to hypertension, ganglion-blocking drugs also found use in the management of severe pain. They worked by interrupting the transmission of pain signals from the peripheral nervous system to the brain. This made them particularly effective in conditions like neuralgia, a type of pain that follows the path of a nerve. The understanding of the pharmacology of ganglion drugs, however, has evolved significantly over the years. Initially, it was believed that these drugs solely worked by blocking or stimulating the ganglia. But as research progressed, it was discovered that they also have effects on other parts of the nervous system. This has led to a more nuanced understanding of their mechanism of action, and has opened up new possibilities for their use. It's important to note, though, that like any other drugs, ganglion drugs have their share of side effects. These can range from dry mouth and blurred vision to more serious complications like tachycardia or an abnormally rapid heart rate. Therefore, their use must be carefully monitored by healthcare professionals. From their discovery, these drugs have been a game changer in the medical field. But what exactly are they used for today? Today, ganglion stimulating and blocking drugs have a wide range of applications. These drugs, known for their ability to either stimulate or block nerve ganglia, have significantly influenced modern medicine. They are like the puppet masters of the nervous system, capable of controlling the nerve impulses that dictate so much of our bodily functions. One of the most common uses of ganglion-stimulating drugs is in the management of hypertension or high blood pressure. By blocking the nerve impulses that cause blood vessels to constrict, these drugs can effectively lower blood pressure and reduce the risk of heart disease. On the flip side, ganglion-stimulating drugs are often used to treat conditions such as hypertension, where there's a need to increase blood pressure. They can stimulate the nerve impulses that cause blood vessels to constrict, thereby raising blood pressure. Beyond blood pressure management, these drugs also play a critical role in treating a variety of cardiac conditions. For instance, they're used in managing heart arrhythmias, irregular heartbeats that can lead to severe complications if left untreated. By tweaking the nerve impulses that regulate heart rhythm, these drugs can help restore normal heart function. But that's not all. Ganglion drugs have also found their way into the realm of anesthesia. During surgical procedures, ganglion-blocking drugs can be used to create a state of controlled unconsciousness, ensuring patients don't feel pain during the operation. In the world of neurology, these drugs are used to manage conditions like Parkinson's disease. They can help control the tremors and muscle rigidity that characterize this debilitating condition, improving patients' quality of life. And it doesn't stop there. The potential applications of ganglion drugs are vast and varied, spanning across different fields of medicine. From cardiology to neurology, from anesthesiology to general medicine, these drugs have proven their worth time and time again. These drugs have indeed come a long way. But how exactly do they work? Understanding the pharmacology of ganglion stimulating and blocking drugs is crucial. So, let's dive right in. Ganglion drugs primarily interact with the autonomic ganglia, which are clusters of nerve cells found in the autonomic nervous system. This system controls involuntary actions in our bodies like heart rate, digestion, and salivation. Now there are two types of ganglion drugs: stimulating and blocking. Ganglion stimulating drugs, also known as ganglion mimetic drugs, mimic the action of the naturally occurring neurotransmitters in our bodies. They bind to the receptors on the postganglionic neurons, stimulating a response. A common example of this is nicotine, which stimulates both sympathetic and parasympathetic ganglia by mimicking acetylcholine, a neurotransmitter. On the flip side, we have ganglion blocking drugs. These drugs prevent the neurotransmitters from binding to the receptors, thus inhibiting the response. An example of this is hexamethonium, which prevents the action of acetylcholine, leading to a decrease in both sympathetic and parasympathetic activity. Now you might be wondering, how do these drugs work? Well, it all comes down to their mechanisms of action. Ganglion stimulating drugs work by directly binding to the receptors on the postganglionic neurons, triggering a response. This response can be either excitatory or inhibitory, depending on the type of receptor and the pathway activated. Ganglion blocking drugs, on the other hand, work by antagonizing the action of neurotransmitters. They bind to the same receptors as the neurotransmitters but without triggering a response. Instead, they block the receptors, preventing the neurotransmitters from binding and activating the postganglionic neurons. The effects of these drugs are as varied as their mechanisms of action. Ganglion stimulating drugs can increase heart rate, blood pressure, and digestive activity. They can also cause a state of heightened alertness and arousal. However, these effects can also lead to side effects like restlessness, insomnia, and anxiety. Ganglion blocking drugs, conversely, can decrease heart rate, blood pressure, and digestive activity. They can induce a state of relaxation and calm, but can also cause side effects like dry mouth, constipation, and blurred vision. These drugs have a wide range of applications, from treating hypertension and ulcers to managing withdrawal symptoms in nicotine addiction. However, their use must be carefully monitored due to their potential side effects and interactions with other drugs. In conclusion, the pharmacology of ganglion drugs is a fascinating field, with a profound impact on our understanding of the nervous system and the development of new therapeutic interventions. Now that we understand how these drugs work, let's summarize what we've learned. So, we've covered a lot of ground today. Let's do a quick recap. We kicked things off with some intriguing facts about ganglion drugs, shedding light on their unique characteristics and how they've been a game changer in the field of medical science and pharmacology. We delved into the captivating history of these drugs, from their initial discovery to their early uses, and how they've evolved over time. Then we moved on to their current applications, which are as diverse as they are impactful. From treating high blood pressure to managing withdrawal symptoms in drug addiction, ganglion drugs have proven to be an indispensable asset in the medical arsenal. But, to truly appreciate the significance of these drugs, we dove into the heart of the matter, the pharmacology of ganglion stimulating and blocking drugs. We discussed how these drugs interact with the nervous system, specifically the ganglions, which are clusters of nerve cells. These drugs can either stimulate or block these ganglions, leading to various physiological effects. Understanding the pharmacology of these drugs is not just about memorizing facts and figures. It's about grasping the underlying principles, the hows and whys of their actions and effects. That's where the real beauty of pharmacology lies. It's like solving a complex puzzle, where each piece is a drug, and the picture they form is the human body in health and disease. By comprehending the pharmacology of ganglion drugs, we can predict their effects, plan their uses, and manage their potential side effects. Such understanding is critical for everyone involved in healthcare, from doctors to pharmacists to researchers. And that's not all. With the rapid advancements in medical science, who knows what new applications these drugs might have in the future? That's why keeping up to date with the latest developments in this field is so important. There you have it, a comprehensive look at the pharmacology of ganglion stimulating and blocking drugs. Subscribe for more because you won't find me later.